Hey, do you have a minute for better health? And to advance medical research too?
Before we start, can we please ask you to subscribe and hit the like button so the algorithm will show this video to other viewers as well, so we can all benefit from this important research? Thanks so much.
We all need good health. So let's advance medical research too. Your support could help a lot. Target disease.
Parkinson's disease. Disclaimer: this is not a medical review but only for education and entertainment. Parkinson's and TBI. Let's do a very detailed high-resolution, AI-assisted, custom MRI review together then. With a TBI there can be a lot of brain blood supply issues and C1 rotations, as trauma can cause rotation of delicate ligament-controlled vertebrae like C1 and C2, as well as structures in a fascia wrapping known as the carotid sheath. This can have many impacts. Let's take a look. Carotid sheath compression is often seen with TBI, Parkinson's, and other neurological disorders.
Mastoid inflammation is easily missed, but not uncommon with rotation.
Chronic inflammation is a big concern with Parkinson's. Carotid sheath, vagus nerve, and the brain can all develop inflammation. As are drainage and lymphatic issues. Rotation can impact lymphatic structures, causing inflammation and other issues. Thyroid disorders can impair dopamine levels, cause cognitive issues, and even impact the ability to smell.
The vagus nerve can be compressed, causing low vagal tone, and many other neurological, multi-system, and autoimmune issues.
The vagus nerve controls rest and digest functions and organs, so can be very related to glucose processing, and diabetes, and now linked with cancer cell development too.
Low vagal tone is part of many cancers, and other neurological conditions too.
The brain relies on the internal jugular veins and the vertebral veins for drainage, but both can be compressed with rotation, reducing drainage and causing higher pressure issues. Higher intracranial pressure can cause headaches, vision issues, and problems delivering oxygen to the brain, which can cause cognitive issues aka brain fog, as well as other pressure-related issues. Lymphatic and glymphatic system impairments can cause many metabolic waste removal system issues, which also favor dementia and cancer development too. Moving away from the carotid sheath now, can overlap with dementia. Blood supply to the brain can be reduced, impacting substantia nigra neurons, which produce dopamine. The reduced metabolic waste removal from venous restrictions, impaired lymphatic and glymphatic systems from compression and rotation issues, reduction in oxygen from higher intracranial pressure, and lowered dopamine levels cause many neurological issues. There is much overlap with multiple system atrophy and also with cancer. Let's look at some of the major Parkinson's symptoms and see how these can relate to these new findings. Tremors. The reduction of dopamine levels from blood supply issues to substantia nigra can have a big impact on how smoothly muscles can work. Thyroid dysfunction. As just seen, the thyroid gland can also be impaired, causing inflammation and other issues with important hormones like T3 and T4. This can impact many systems, including cognitive functions, and even the sense of smell. It's even important for dopamine production. Vagus nerve dysfunction. This can impact many systems, as it regulates the digestive versus the inflammation type responses. Brain chemistry can then be affected with excess inflammation and chemicals that can encourage the development of Lewy bodies, a common feature of Parkinson's. As the vagus nerve regulates the rest and digest parasympathetic system as well as the fight or flight sympathetic nervous system, it can influence the chemicals in the body, so can account for the Parkinson's scent with different chemicals, like sebum, with their distinct smells. As shown, the vagus nerve is often compressed with the TBI, which causes low vagal tone, as usually seen with Parkinson's. Dogs can detect these smells. It is seen with POTS cases as well, where heart rate regulation is impaired, again regulated by the vagus nerve. The role of the vagus nerve in these issues is so large, it can affect neuromuscular action chemicals like acetylcholine release as well as glucose processing, as is an issue with diabetes, which very often also leads to dementia. There is even discussion of how dementia can be considered as type 3 diabetes. The issues can overlap so much. Combined, these issues can impact many important systems in the body, and also account for issues like rigidity, gait issues, anxiety, excess sweating and sebum secretion, sleeping disorders, and even digestive and other systems. Another big issue is that when Parkinson's symptoms appear, it can often be already too late, so early attention is so important. For the tremors of Parkinson's, there is much research with devices and even new developments with older therapies like acupuncture and acupressure, as these can stimulate nerves such as the vagus nerve and others. This can have benefits to PD sufferers. As laws on substances like CBD change, there's new understanding on how the benefits such as vagus nerve stimulation can help not only regulate the sympathetic nervous system responses, but also the peripheral, somatic, and central nervous systems too. So the intention of sharing all this advanced knowledge with you is to help give you a better understanding of the most often seen instances and impacts, so you can recognize and try to resolve these issues conservatively, before the symptoms are developed enough for disease diagnoses. But this can never succeed without your like, share, and comment support.
With early attention, many of these issues can be improved, often with gentle, conservative methods. Resolving issues can help avoid diseases. This is an example of custom user-driven in-depth radiology reviews.
This is our concept of grassroots radiology.
Information you can use today, and the basis of support for the needed medical research articles for tomorrow. Always based on a health and wellness focus, to avoid the need for drugs and surgery whenever possible. By leveraging technology, relentless innovation, high-resolution small-slice imaging and custom review protocols, for early detection and to avoid disease processes. For more details on any of these topics, please see our other free publications. Only your support can make this concept work. Please like, share, comment, and follow.